Hi, everyone. Thank you for being here today. I'm Pei-Ning Zhang, Senior Community Engagement Manager with the Alzheimer's Association, Northern California and Northern Nevada chapter. We're excited to talk about Asian American and Pacific Islander Heritage Month today. Just this month, we've had our 12th annual Cantonese Forum, local families speaking on a national roundtable discussing research in AAPI community and the importance of recruiting AAPI participants in research involving Alzheimer's disease. And just 2 days ago, we had a webinar, Help and Hope, Walking the Dementia Journey Together for the Japanese American community with close to 100 people attending. Many more education programs and support groups for the various APS subgroups are happening locally in person or online. We are so pleased to have 2 volunteers here with us today to talk about their experiences, including cultural sensitivities and stigmas. June and Stan, you two have something in common. Both of your parents are living with or have lived with Alzheimer's disease and dementia. June, you have been an advocate and our Japanese American Advisory Council member for 2 years now. And Stan, you first came to us through a support group, then you began to volunteer for us by helping us tabling at health fair, supporting our advocacy efforts, and being a San Francisco Walk to End Alzheimer's committee lead. June, let's start with you. Can you please share how you first learned about the Alzheimer's Association and what you would tell a family caregiver who asks for your advice?
Sure. Yeah, I actually knew of the Alzheimer's Association, but didn't use the platform. Early on, someone sent me a link to something about Alzheimer's when my mom first got diagnosed, and it was a horrible, horrible site, very, very tragic. And so I didn't want to learn about anything that I was going to go through if it wasn't going to happen, or so I just wanted to just go through my journey with my parents with Alzheimer's as it went. Now looking back, I'd wished I had used that the Alzheimer's Association. They have support groups, they have educational information, statistics that could have helped what I was going through. I feel like it's something you should learn CPR or an emergency route. This is something you should be up on, not even when you get, if someone gets Alzheimer's, but even before, just like the warning signs. And so I think it's something you definitely need to get prepared for. So that's, I would suggest go through the Alzheimer's for various things, even support. So, yeah.
Thank you, June. Stan, can you share a little bit about your family story as well? And also, 3 of us, we all attended the California Advocacy Day at the beginning of this month. Can you also share your experience there as well?
My mother actually had a stroke, and when she went to the hospital, they diagnosed her as aphasia, which is a frontotemporal type of dementia. She had to learn to eat and feed herself and speak again. And unfortunately, about 6 months later, she had a second stroke and passed away. So, but the biggest thing that really helped was actually having the support group to be behind me. The other thing that I was able to do is actually go up to Sacramento on Advocacy Day, met with our legislators, and to me, it's very passionate about one of the bills, which is continuing education for healthcare professionals, for doctors, for physicians assistants, to learn more about dementia and Alzheimer's, and that would really help with early detection and diagnosis.
Thank you. I want to go back to June. When you moved your parents back to Japantown in San Jose, you gained the support of that tiny community. Can you tell us more about that experience and how that community come together to help you?
Yeah, San Jose Japantown is actually in the middle of where my home was, my personal home, and my parents. And so I actually moved them to an apartment complex in Japantown just so I could move in and help out. And it's where my parents met. And so it was very familiar to them. And I would down for walks every day, and the community got to know them as a little fixture, and they got to know their routine. And so it was really nice to have restaurants that would offer food, or the Lotus Preschool. They would tell me when certain events were happening so I can bring my parents to watch the kids outside. And the residents, they would also actually help me with, if I had to go somewhere, they would watch them for a couple hours so I get a little respite. And it was really, really nice to have that support behind me and feel like I wasn't alone.
Yeah, and also, yeah, you just had the events to kick off
Mhm.
dementia-friendly community for for the community, because you want to give back, right? To help more
Exactly.
families. Yeah, that's
Yeah.
wonderful.
Thank you.
This last question is for both of you. Can take some time to talk more about the caregiver stress. Caregiver stress takes its toll on your emotional well-being, and oftentimes family caregivers suppress their own needs to the detriment of their own physical and mental health. We've heard a lot of stories about that. So can you please share what you did to cope all these years and advice to other caregivers? Let's start from Stan.
Yes, one of the things that for me that was really helpful was, since I was going to monthly meetings for caregiver support through the Alzheimer's Association, was actually developing a list, because it'd be like, I've got to ask, how do I handle this when my dad keeps on repeating himself? Or the fact that they're starting to wander, or they're accusing people of things. It was really so helpful to learn and develop those tools to be a good caregiver for them. And also to realize that if somebody says, "Can I help?" Do that. Reach out to your family, friends. And if they want to help, say, "Could you come over just for a couple hours and just get out of the house so you can clear your mind?" Because self-care is the most important thing about being a caregiver, since caregivers of people with dementia have a greater rate of stress and burnout. So it's important to take care of yourself. And then on Advocacy Day, that you mentioned, we were in Sacramento. We got to meet with legislators, and it was great because there was one of the bills of the three that we were discussing, which was continuing education for healthcare professionals, so that doctors as well as physicians assistants could learn more about Alzheimer's and dementia, so they could do a better job in early detection and diagnosis.
That's wonderful. Thank you, Stan. How about June?
Yeah, I always thought that I could take care of my parents better than anybody else. So I should have done a better job at reaching out, but definitely, like Stan said, if someone uh, offers help, you take it. And because you need that. I also went to a support group at UIKai, which is at the senior center in Sansei, Japantown. And that really helped, because you could relate to each other, and you, again, did not feel alone. Because with the Asian community, there's a stigma. And I think with Alzheimer's, there is a stigma overall. But I think within the Asian community, more people don't talk about it. And so it was nice to relate to people who were in the same situation and same background. So I was thankful for that support. And I'm one that is very open. And so I definitely reach out, and would, would suggest that people do the same.
Thank you, June. Yeah, I also heard some caregivers sharing that telling their story is also part of their healing too, because by sharing their story, they're helping other people while they can just feel like they are doing something, contribute to the society as well. So we're so appreciative of your time and sharing your family's journey with us today. Cannot thank you enough for being such wonderful volunteers and resources to our AAPA communities. We've done a lot of things together. We do a lot of education programs. We go into communities. We go advocacy together. So I just want to let all the audience knows that, remember, we are walking the dementia journey together. You're not alone. Thank you for joining us today. See you next time.
Thank you for having us. Thank you.
Thank you.